Hi, welcome to Mental Health America's unique social inclusion program, Peer Partners. I'm Patrick Hendry with MHA's National Office, and I'm going to lead you through 9 mini training webinars as part of our new distribution format, Peer Partners in a Box. Before we begin, I'd like to congratulate you on deciding to become part of our Peer Partners family. This is a unique self-directed social exploration program that is designed to help people find meaningful relationships and friendships in their community. In recent years, there's been a lot of research that has shown that loneliness and social exclusion have devastating effects to overall health. In order to combat this, Mental Health America has created the Peer Partners Support Group model. This is a program that was conceived, designed, and implemented by peers for peers. We've structured Peer Partners as a support group that is facilitated by a peer specialist who works with the members to develop their social plans that reflect the type of life that they would like and are willing to make substantial changes in their lives to achieve. Peer Partners is a unique combination of peer support, self-directed care, and psychiatric rehabilitation, and it is heavy on peer support. In the 1990s, when we first started talking about recovery and mental health, we surveyed peers all over the country to find out what they attributed their personal path to recovery to. And the number one answer for people 3 years in a row was having at least one person who had their back, one person they could count on, one friend. And when we surveyed new members of our Peer Partners group, we found out that the unanimous goal was to have at least one friend. Mental health problems are one of the leading causes of loneliness and isolation. Sometimes it's because we're afraid to be around other people, and sometimes it's because other people are afraid to be around us. Research has shown that social connectivity is a powerful tool for achieving recovery and creating opportunities for having a life that is meaningful to the individual. Again, in the 1990s, research showed that traditional approaches such as medication, hospitalization, and psychotherapy have a limited effectiveness when applied to socialization and work aspects of individuals with psychiatric disabilities. Our goal with Peer Partners is to help people build networks of friends and intimate relationships. This creates a strong social support system. Positive social connections increase self-esteem and our feelings of self-worth. Self-esteem and self-worth are critical to self-love. I love this quote from Oscar Wilde. To love oneself is the beginning of a lifelong romance. Individuals living with serious psychiatric issues have faced a number of problems in finding a meaningful life in their communities. For many, many decades, separation is what we did. We pushed people away from the mainstream of community. We had people in long-term hospitalization, living in group homes, and segregated from the rest of the community. Then we began to move into the community as hospitals deinstitutionalized, and people came back and they could live, work, and play in the community. But frequently, we didn't feel like we were a real part of that community. Community housing is often a gateway to integration without inclusion. What we want is inclusion, where we are essential parts of our communities and that we function in every aspect just like the rest of the citizens in the community. In order to ensure the success of Peer Partners, we've created the Peer Partner model. And this is the breakdown that we'll use for the sessions that follow this one. The first thing is peer life coach training. And this is where life coaches or peer specialists learn new skills in self-direction, in goal setting and motivation, in psychiatric rehabilitation skills, and enhanced peer support techniques. The next step is recruitment. And this can sometimes be really difficult because the idea of change for some people is very scary. And people are frequently reluctant to risk the type of change required in order to achieve what they really want out of their lives. The first goals that we try to set are goals for the program itself. What do people want their lives to be like? What do they want to achieve through this program? Now, when you talk to people who have lived much of their life in hospitalizations or in group homes or in other settings where they had very little power and control, people sometimes have very, very narrow horizons. When you ask them what are their goals, they might give you an answer like, to stay on my medications, to stay out of the hospital, to stay out of jail. One of the best aspects for the peer life coach is when they see someone get that aha moment, the realization that life can be much broader than they had thought before. The next steps are a series of skill building exercises, and the groups get together and they decide on the type of skills they would like to work on. We use some psych rehab, social skill building. We use some other type of role plays and community activities that help people develop what they feel are the tools they need in order to go out into social gatherings and into the community and find the kind of relationships they're looking for. Once we've gone through that phase, which actually continues throughout the program, the next step is social outings. And when we say social outings, we don't mean like a group trip to something in the community. What we do is that in the support groups, people identify things that they like to do, things of interest, activities they enjoy, whether it's going to concerts or taking lessons in art or photography, or we've had one woman in our class whose main thing that she loved to do was baking. And so the people in the support group get together and they team up. Now, it may not be that each person has the same goals, but they're willing to support their partner to go out and engage in these activities that they've identified. The purpose of this is to put people in proximity of other people who enjoy the same things, because when you have the same interests, there's an opportunity for a conversation. And a conversation is an opportunity for the beginning of a relationship. We also teach evaluation techniques in order to look at the program from a critical point of view and make sure that it's functioning the way that we intend it to function. Part of evaluation is ongoing or quality assurance, so that we are always increasing the effectiveness of what we're doing. And then finally, everyone needs results. Funders need results, but we do too, because we want to know that if we're not making people's lives better, then we need to do something else. Mental Health America's original social inclusion program was called It's My Life. And in It's My Life, individuals working directly one-on-one with a peer life coach would go into the communities for these activities. And it was very effective. The problem is it's also very expensive because it requires full-time service of a number of peer specialists in order to serve a significant number of individuals. So we created the peer partners model, which is based on the support group idea. One of the real benefits of the support group idea is that you've really exponentially increased the availability of peer support because everyone in the group supports each other. It also provides a safe space to practice social skills. Everybody gets together in their meetings, they identify the type of skills they want to work on, and it becomes a group activity that really creates an enjoyable experience for everyone. Whereas if it was done in a classroom type setting, it might be something that was off-putting or even just an experience that we didn't care to participate in. The shared experience of social challenges promotes a sense of compassion among each other. So when the people peer up in the groups, they care that their partner will succeed in achieving their goals, and in return, their partner cares for them. They observe others as they face these social challenges, and this tends to normalize their experiences. When the support group comes back together after a week and everybody kind of reports out how their week went and how their forays into the community went, people talk about it, and it becomes something that is, this is day-to-day life. This is normal. This is what people do. We also are able to control costs much better by creating a support group model, again, because we're not requiring so much time of peer staff. So this has been kind of a quick overview of what Peer Partners is all about. And we want to thank you for joining us for part 1 of our Peer Partners mini webinar series. So please check out the rest of our series. Part 2 is Peer Life Coach Training. Thank you.